Thank you and good morning, доброго ранку. From UK, I'm very pleased to be at your conference and very grateful to the Ukrainian Association of Family Medicine and the National Academy of Postgraduate Education for this invitation to attend this opening plenary. It's really exciting always to see another country making progress with family medicine, and as we have already heard, your history here is already strong, 25 years, 15 years for the association. And it's been an honor for me in the last 2 days to hear more from the Academy about their excellent work, to have an audience at the ministry, and to visit a family medicine clinic. So, congratulations on your work so far, and I hope for the very best for your future. I also wanted to acknowledge that you are mourning the passing of Professor Grigory Lysenko, who was kind enough to invite me for this visit. And I would like, on behalf of the Royal College of General Practitioners and the World Organization of Family Doctors, WONCA, to express our sincere regrets and the respect for his memory, respects to his family, to you as his colleagues. I know he was a great leader for family medicine in Ukraine, and I'm sure his influence and vision will live on in your hearts and your minds, in the legacy that he has left through family medicine departments and doctors across your country. I think at such a time, these thoughts are not much compensation, but I hope that they will encourage you to carry on his work and sharpen our resolve together to continue to progress the great ideals for which he worked and hoped. So the title for my talk is The Equity Challenge, how family medicine can improve population health and strengthen our standing in professional practice. In WONCA, we have been talking for a long time about the concept of equity for patients across different countries, equity within health systems, and equity for family medicine as a specialty within medicine. I have 4 simple messages. We have already heard every country needs to make its population as healthy as possible, and a strong discipline of family medicine is key to this. So by performing this important role in the health system, our discipline can gain a status. But in order to do this, family medicine must really be given the opportunity to be designed and delivered effectively to fulfill this role. So I'm going to talk in 3 parts. First of all, what is equity in the context of healthcare? Then, the importance of family medicine within the health system to achieve these outcomes, not why, but how it can do this. And finally, making some arguments for why at this time family medicine must be treated equitably as a specialty so that it can be really effective in Ukraine and in other systems. So what is equity? People often confuse equality and equity. Please wait. Equality is about numbers and sameness. The same numbers, identical or fully equal rights. So when we're talking about equity, people often confuse equality and equity. Equality is about the same numbers. So, 1 doctor for 3,000 patients or whatever your government is saying. But equity is about ensuring that the allocation of resources is fair and just. So it may be in a program or for opportunities for different people with different needs and requirements. So for the horses, I'm sorry I can't do the pictures at the same time, but for these ponies, the little pony needs a feeder at a different place than the big pony. If it's too low, the big horse has to bend down. If it's too high, the little one can't feed. The saddles have to be different sizes. The big saddle would crush the small horse. For you know, I'm sure that if there are 2 men's toilets and 2 ladies' toilets, there is always a big queue for women. So this is an equity issue. And for my elderly patient at the top, she may have different needs on how to connect to her family medicine clinic. Maybe she can't get there at all. Maybe if she comes to the building, she can't come up the steps. Maybe she can't telephone because she's deaf. Or maybe in our country we're now using the internet, but many older people are saying, I don't know how to do this to make my appointment. There is an equal opportunity, but not an equitable opportunity for this lady. And in the last picture, the picture in the developing low resource world, of course we know that there is huge inequity in health and in health care in some of those countries, and less facilities often in urban and rural than urban settings. So one type of health service cannot fit everybody. Next slide, please. Thank you. Now we have inequity in the UK in health, and so when we talk about equity, we are also needing to look at historical situations that we need to rebalance through these different social policies, not just health alone. In the UK, we've already had a significant program of work on this in health. I've one report from the UK which I summarize some facts in this slide. It's called Fair Society, Healthy Lives, and it concludes, in England, many people are currently dying prematurely as a result of avoidable health inequalities. Could otherwise have enjoyed in total between 1.3 and 2.5 million extra years of life. That's a huge health gap between the most healthy and the least healthy. There is a social gradient in health, so the worse the person's social position, the worse his or her health. And to reduce this gap, actions have to be taken for all the population, but particularly targeted for the least advantaged. And reducing health inequalities needs to act at many levels, but particularly in relation to family medicine. The report talks about the need for us to strengthen our role and our impact on ill health prevention, including working on adult lifestyles, the care of children and young people, and empowering and embedding our work in local communities. So I think that also includes the need to empower family medicine to do that work. Otherwise, this gap in equity cannot be addressed. So we know that to achieve equity or to begin to work towards equity in healthcare, you need doctors, nurses, and other health professionals who can look after people's acute illness, but also work with this preventive work and chronic disease. And these staff, we also know, will face big challenges. Next slide, please. So in Ukraine, looking at your health statistics, I just give a few examples. On the left, you have high rates of lifestyle issues, but also some serious infective conditions. And UK is not unfamiliar with this, but I give you 2 other examples. We still have a high rate of unplanned teenage pregnancies, and that, particularly for young women, will disrupt their education and their life chances in many situations. And we also don't have the best statistics in Europe on the diagnosis of cancer cancer.
І в нас
So,
найкраща статистика з
These
Європи по
conditions
діагностиці
are
своєчасній
amenable
раку.
to early interventions
І
in
ці
the
умови
community
можна
setting.
покращити
And
тільки
so
втручанням на
this
рівні
is just a
громадки,
few examples
на
where
рівні
family
місцевих
medicine
громад.
can be really
Це тільки декілька
important
прикладів, де
in
може бути дуже
reducing
важливою
avoidable
сімейна медицина
morbidity
у
and
зниженні
mortality
захворювань,
and
які можна було
improving
б
health
уникнути, і
equity.
смертності, якої можна
But I would
уникнути, і
like you
покращенні
to remember what
справедливості
the
у наданні
evidence is that
послуг
supports your
охорони
role
здоров'я.
in your health system. Next slide,
І ці
please.
факти, які підтримують вашу роль у
We
системі
often
охорони
claim
здоров'я як
the
сімейних
evidence
лікарів.
of Barbara Starfield for the role of family medicine. I know your government has listened to
результати
this,
відповідного
but
дослідження
I would like to quote one of her
про роль
best-known
сімейної медицини.
papers about
Це
the evidence for
найвідоміші
primary
статті,
care.
найвідоміші
And you can read
дослідження.
this yourselves,
І ви можете прочитати
listen to it in
самостійно
your own
цю
language.
статтю на
Health is
вашій
better in
мові.
areas with more doctors working in
Здоров'я
primary
краще
care.
у тих зонах, де
People who
є
have
більше
access to primary care are
лікарів,
healthier than
які
those
надають
without.
первинну допомогу.
The more the
Люди із
full
доступом до первинної допомоги
comprehensive care
здоровіші,
of
ніж ті,
primary
які його
care
не мають.
at the
Чим
point of
більш
use is
всеохопніша первинна
available,
допомога,
the
і
better
чим
the health
більше
of the
амбулаторних
population.
пунктів, тим
And
краще
I will
здоров'я
remind you what
населення.
ideal family medicine looks like in
І
a
ви
moment.
знаєте, як виглядає
Universal
ідеальна
access
сімейна медицина.
is associated with reduced
Універсальний доступ
inequalities.
до первинної
And if you
допомоги
have
пов'язаний із
big enough
зниженням
quantity and a good enough quality
несправедливості
of family
і з
medicine
кращими
and primary
результатами
care,
охорони здоров'я.
then you
Що
begin to
стосується
get
якості і
lower
кількості
and
первинної
more
медицини,
effective
тут
use of
треба
hospital
спускатися
setting.
на нижчий
And
рівень і
then,
краще
and only then,
організовувати
once family medicine is
використання
embedded, you start to see the costs
лікарняних
go down.
потужностей. І тут буде зниження витрат на
And
медицину.
Barbara also told us that
І Барбара Старфілд також
increasing
сказала,
one
що
primary care family medicine physician per 10,000
посилення ролі
population
сімейних медицинів,
would give a gain
збільшення кількості
for
докторів
a
на
magnitude of
10
improvement
тисяч
3
населення
times this
3 рази
amount on
покращує
health. So this is
показники
supported by other family medicine research.
по здоров'ю цьому населення.
And we can
Це також
therefore see
доказова
clearly that
база
strong
для ролі
family
сімейної
medicine
медицини. Ми також
underpins
можемо чітко
population
бачити,
healthcare.
що
Next
сильна
slide,
сімейна
please.
медицина – це пов'язано з загальним станом
Thank you.
покращення охорони
So
здоров'я
this
населення.
shows, just to remember, what
Це
a good
основні
family
принципи,
medicine
які
product
нагадують,
would look like.
яким
It
чином
has
має
to cover
виглядати
the whole
сімейна
life
медицина, її
cycle,
продукт.
from
Вона
birth
має охоплювати
till
повний
palliative
життєвий
care and
цикл.
death. It has to be good enough quality.
Має
We have to think about what
мати
is the
достатню
need of our population,
якість.
not
Ми
just the
повинні
demand
враховувати
of the
всі
person in
потреби
front of us,
населення, не тільки
because often,
індивідуального
like my
пацієнта,
elderly
який
lady
перед
in
нами
the
знаходиться.
picture,
Наприклад,
it's the
як
people who don't
оця
make the demands
пожила
who
жінка
have the biggest need.
на
The
фотографії.
people who don't feel
Люди
able
можуть
to
мати
come forward, maybe
дуже
they're
різні потреби.
embarrassed,
Вони можуть
maybe they're afraid,
не прийти
and we
на
need to
прийом,
make sure
тому
that our
що
services are really
або
open to
залякані,
them
або,
to meet the need. To do the
не
preventive
мають
work,
на
to
це часу
get
або
people
бажання.
to come and
Тому ми
have their
повинні бути
screening and their
проактивними,
checkup,
ми
and to
повинні
encourage them
займатися
to look after
профілактичною роботою,
themselves,
заохочувати людей,
and
щоб
so on.
вони
And this
проходили
specific
скринінги, щоб вони
focus on the underprivileged and the underusers of
зайнялися собою
services.
в цьому
So when
сенсі.
we
Це
are
також
talking about
частина
strengthening
наших
health
послуг.
systems,
Коли ми
next
говоримо про
bullet,
посилення
please.
системи сімейної медицини,
You need to look at this in
треба
terms
розглядати
of the
оці
physical
компоненти,
facilities,
фізичні
how we share information with our
потужності, яким
patients,
чином
how
ми
we encourage
обмінюємося
them to
інформацією
use
з
our
пацієнтами,
services,
яким
what
чином ми
is
заохочуємо
culturally
використовувати
appropriate,
наші
what
послуги, які
resources we
культурні
need
традиції
to
існують
do
в цьому
this job
сенсі,
well,
які ресурси нам
and
потрібні,
also
щоб
what are
хорошо
the
виконувати цю
principles,
роботу.
the
І також
moral
які
values
принципи
on which
і
we are
моральні цінності, на
organizing.
яких ми організуємо нашу роботу.
I was very encouraged to hear when we were
Я
with the
дуже
minister and in the
заохочую,
talk this morning, reading
коли
about
ми
your
були в
reforms,
міністерстві,
that
коли ми сьогодні утром
new
говорили
resources
щодо
are
реформи,
coming into family
що
medicine.
треба вкладати нові
And
ресурси,
UK has followed a
додаткові
similar
ресурси в
pattern.
сімейну
Next slide,
медицину, як
please.
це відбувається
So
в Великобританії.
we have
наприклад.
already seen some
Ми вже
investment
бачили
in our
багато
premises and our
інвестицій у
services.
потужності, у
We have
послуги.
moved from being
Ми
rewarded
перейшли
just for the
від
numbers of
фінансування
patients or the
просто
numbers of consultations to the
кількості
quality indicators
консультацій,
of the
кількості
care we
пацієнтів до
give.
якості
Again, that helps
тих
us
послуг,
to make
які ми
sure we're
надаємо,
providing
щоб забезпечити,
services
що ми надаємо
for people's actual
послуги
needs.
для людей,
The
які
UK has
дійсно
invested
потрібні.
heavily in
Великобританія
training
дуже сильно
in
інвестувала
family
у
medicine,
навчання
both
у
in the
сімейній
postgraduate
медицині.
residency training,
Післядипломне
but also
навчання
during medical
інтернів, але
school,
також і у
enabling
університетах.
family medicine
Це
doctors to
дозволяє
be trained
врачам
as
сімейної медицини
supervisors
одержувати
and
навчання
tutors
як
so that they can bring forward new family
щоб
medicine doctors
просувати
and
нових
to really
лікарів
give them
сімейної
a
медицини
good
і надавати
training
їм
in
належне
our discipline.
навчання цієї
And there has
дисципліни.
been some investment in
І
leadership of
відповідні
the
інвестиції
service, so
також
getting
у лідерів, у
GPs,
лідерство
family
цього
medicine
сектору,
people involved
людей,
in the
які
regional
практично
planning
працюють
of
загальними
services, so that it is
лікарями,
oriented to
сімейними
their
докторами,
communities, not
щоб
just to the influence
вони
of
орієнтували
hospital specialists.
відповідну громаду.
And finally, I think we have
рух до цього, не
recently
тільки
agreed
лікарів.
that we still don't
І
have
ми
enough
нещодавно
family
також
medicine doctors in our
домовилися,
country,
що у нас
and that the government will shift
є сімейні
investment.
доктори
Now that's a
в нашій
challenge
країні, і
professionally
більше
because,
інвестицій
like
буде
you,
вкладатися,
we
власне,
will
в
have to
цей
train a
сектор.
lot
А
of
це
new
є
people quite
викликом, тому що
quickly,
нам дуже
and we are
швидко
still
треба
discussing with our government
навчити дуже
how we
багато людей. І ми
resource
ще
that
продовжуємо
effectively. But it is
з
very
урядом
important that we
обговорити,
move
яким
enough
чином
people from
ефективно
hospital
застосувати ці
numbers
виділені
into
ресурси,
community
які
specialty,
виділяються на
so
навчання.
that we really can embed
Таким
this
чином, щоб
service
ми
for the long term.
могли
And I think that's probably even more important
надавати
here
цю послугу.
than
Я
it
думаю,
is
що це є
in UK.
найважливішим питанням наразі
Now, I
в
know that
Великобританії.
you've achieved a lot, and
Я знаю, що у
before I
вас є
came
багато
to my
досягнень.
visit,
Перед тим,
I'd
як
already
приїхала
read an
до вас в
article
Україну,
that
я
was written in
вже прочитала деяку
2008 by
інформацію,
Professor
статтю,
Lysenko
написану
with
професором
Dr.
Лисенко
Kimian and
в
Dr. Trevor
2008
Gibbs,
році
and
разом з доктором
I
Кім'яном.
could see already
Я
on the left-hand column that you,
могла
even by
порівняти
2008,
зліва
you had achieved a huge
ваші
amount.
досягнення на
But
цьому
at
слайді
that time, the
показано.
article said that you
Але на
still
той
had
час
some
стаття говорила,
challenges.
що є відповідні
That
проблеми, відповідні виклики.
questions around the curriculum, the
Питання
support
щодо
for
впровадження
training,
в навчальні
trainers,
програми,
training
питання
practices,
підтримки навчання.
some lack of opportunity for residents in family medicine to have
Не
vocational
вистачає
training in the
можливостей
relevant
для
specialties.
навчання спеціалістів за
Some
відповідними
opposition from
дисциплінами.
other colleagues, problems of
Деяка
salary
опозиція
and
з
status.
боку
I'm sure
колег і
this
з
is
боку
familiar to you.
чиновників на місцях. Я думаю, ви
And I was
знаєте, про
interested
що
to
йдеться
see
в цьому
that your
сенсі.
Family Medicine Association
Цікаво
still has some of these issues
згадати, що
on your
і,
agenda for your council at the
Українська
present
асоціація
time.
сімейної медицини стикається з цими
So,
проблемами. І
Nevertheless, I've been really
Тим не менше,
excited by your reforms, and I hope that when I come again in a few years' time, I will see many of these challenges are.
Я знаю, що
over.
у нас були точно такі ж проблеми.
So I would like now to, in the last part of my
Ми
talk, offer you some
подолали
ideas
у
about how
свій час.
you can further, we
Я хотіла
together
би
can
обмінятися
improve
ідеями,
our
як ми
situation in
разом
family
можемо подумати
medicine.
над тим, як
Next slide.
покращити ситуацію в галузі сімейної медицини в Україні.
There is an overwhelming literature on
Є дуже
leadership
багато літератури
and how to
щодо
manage
лідерства,
change and what is
яким
needed in
чином,
professional development. I don't want to do
впроваджувати
that in
менеджерство,
detail,
яким чином професіонально
but I think
розвиватися. Я
these
тут не буду
6
детально
points
зупинятися,
help
але
us to
я
think
хочу
about
підкреслити
what we
ці
need
6
to make
ключових
things
моментів,
happen.
що нам потрібно для того,
First
щоб
of all,
здійснювати
you need a
діяльність.
clear
Перш за все, вам
vision.
потрібне чітке
That's why I
бачення.
showed one slide to remember
Тому я
what good
цілий слайд
family medicine
виділила
looks
тому,
like. Because quite often we
яким
have
чином
to
має
remind
виглядати сімейна
colleagues
медицина, добра сімейна медицина,
that
тому що дуже
some
часто ми
part is
забуваємо нагадувати
missing
колегам,
and
що
we
чогось не
need to build
вистачає.
it back in.
І нам треба
So we
це
need a clear vision of the service
відновлювати.
we're
Нам
trying to
потрібно мати
achieve,
чітке бачення
one that
того,
is
цієї послуги,
person-centered
яку ми хочемо
rather than
надати, щоб
disease
вона була
focused,
сфокусована
doesn't
на
only benefit
особистості,
the whole
на
population, but
пацієнті, а не
particularly the
на
socially
хворобі.
disadvantaged. And that looks
І
after
особливо
people
на особах
across their
із
different problems. We know that primary care is much
важкому
more effective
становищі.
at dealing with people
Ми
with
можемо бути
multiple
набагато
morbidity,
ефективніші,
multiple problems,
працюючи
than
із людьми,
hospital
які
setting where they will
мають
go from
багато
clinic to
захворювань
clinic to
одночасно,
clinic
аніж,
because they have different problems in different
чим вони
systems.
підуть по
Then
лікарням з
we
різними
need to be
хворобами,
true
переходячи
to our
із
core
відділення в
values
відділення щодо
that
різних хвороб.
motivate us in family medicine
ці
and keep us
цінності, які
trying
можуть
to
нас
do well
мотивувати
even when
в
things go
сімейній
hard.
медицині. І
I found a short part of a poem
нам
from
треба
Yevtushenko
витримувати
that
ці
made me think
труднощі.
of this. All humans
можу
are
привести вам
noteworthy.
вірші Євтушенка
Their
з цього
lives
приводу.
resemble those of the
Людей не
planets
интересно
in the
измерение их
skies.
судьбы, как история
Each is
планет.
specific
У
and
каждой все
unique.
особое,
Indeed,
свое.
no
И
planet
нет
is
планет,
identical.
похожих на нее.
And that's very much what family medicine is always doing, looking at this individual. We're driven by the needs of our individual patients to try to make the conditions that will give them good care in their level, in their place, in the way they can accept it in their own lives. Then we need evidence, this work to build up research capacity in your clinics to help the university colleagues to do research in primary care is absolutely essential, because that way you will show both the quantity and the quality of the work that you do and show what matters. We all know across medicine that research is needed, but we need to show that we are achieving targets for healthcare and how we are doing this, again to address equity principles. We also need allies, so partnerships, collaborations and friends in influential places. And as I've taken up more leadership roles in my own way, I've become increasingly aware that it is part of our responsibility to keep explaining to other parts of the system, governments, universities, other specialties, and the public, what we do in family medicine. Because if we share this properly, then our partners, our allies understand the problems, and this may broaden their minds and help them to help us. We need stamina and determination. I think Professor Lysenko worked for a very long time for some of these goals, and we know that nothing is ever easily won. And I guess that does bring me to role models, and I am going to show you 3 role models, what they have done to improve the status of family medicine, and hope that we can draw inspiration from them. Excellent. So I refer, of course, to Professor Lysenko, but also to 2 colleagues, Professor Carter and Professor Lester, friends and close colleagues of mine in the UK, who we have lost from our community in the last few years. Professor Carter was the first woman professor of general practice in the UK. And I feel sad and angry that all these talented colleagues and talented leaders were taken from us when family medicine still needs these champions. Another part of the poem, people pass away, they will not return, their inmost world will never be reborn, and my heart just screams at the irretrievable, unfair course of things. So I spent a little time looking at this achievements of Professor Lysenko in relation to the curriculum vitae, the obituaries of my 2 colleagues from the UK. And I brought together the things that I think they had in common, the secrets of their success. They had a strong belief in family medicine, even at a point where that wasn't very fashionable. Maybe not even very good for their careers. I know that, for example, Yvonne was told she was too clever to do family medicine. She was clever, but she did family medicine. They made really good academic achievements, so that they were credible and their scientific endeavor could not be questioned by other specialists. Indeed, were admired for their work. They made a real commitment to the health needs of their population. So Professor Lysenko's work on autoimmunity and rheumatological conditions, Professor Carter's work was on child safety and accidents and on the care of the frail elderly. You can read her work, of course. And Helen Lester was persistently committed to the needs of the severely mentally ill. Her last lecture, when she was already very sick, was called "We Need to Talk About Billy." And you can see this on YouTube, and I would really recommend it, about how we need to look after the most vulnerable. Then they made themselves champions through taking up leadership positions so they could argue from a position of power, And we certainly need people to do that for
Нам
us.
необхідні люди, які
But they were also,
повинні з
I
силових
think,
позицій
all
допомагати нам
people.
впроваджувати
They
принципи
related
сімейної
to their
медицини.
students,
Ці люди
their
є
patients,
люди, вони
their
пов'язані
colleagues.
із
They would
студентами,
always
з
give
колегами, з
time. They would always give
пацієнтами.
time to young doctors and
Це
their mentees,
Вони
generously
приділяють
and
час молодим
effectively
лікарям.
in order to assist the development
І
of
треба це робити
others.
ефективно, щоб допомагати
And I think
розвитку
very
інших
importantly, they had a
спеціалістів. Я думаю,
life
дуже
outside
важливо,
medicine. We all
вони
work very
мали
hard
життя
and we need
також не
to
тільки
balance, and I
медицини.
know
Ми
these
повинні
colleagues
дуже
had a love of
наполегливо
life in
працювати, а
that
треба
broader
мати
context. They were all talented
відповідний
people
баланс. Вони були
whose lives
талановитими людьми,
enriched those of others.
і вони ділилися цим
So I
життям
think
з
we must
іншими.
thank them.
Я
And
думаю,
we
ми
must
повинні
mourn them,
згадати
and we
їм і
must follow their
подякувати їм, і
example.
повинні наслідувати
We need
їх
to
приклад.
carry on
Нам
this
потрібно
effort
продовжувати їх
to meet
роботу
the
і
equity
зусилля,
challenge,
щоб досягнути
We need to
справедливості,
improve family
щоб
medicine
подолати цю проблему
so that
несправедливості
we
в
improve
медицині. Ми
the
повинні
patient's
покращити
health,
сімейну
but
медицину,
also so
ми
that we
покращимо
strengthen
здоров'я
the standing of our own
пацієнтів, але
discipline.
ми також повинні покращити і наші
And
позиції,
again,
як
I'm afraid
дисципліни,
one of the
як
things I
сімейної
do
медицини.
for a life outside medicine is to read and write poetry.
І я думаю,
so
я також
I was
дуже люблю
looking for
поезію,
some
крім того,
poems.
що займаюся медициною.
And
І я тут
before I read
хочу
this last verse,
стати на таку позу, таку
I would like to
позицію.
say I think the revolution
І перед
in
тим,
family
як
medicine is
останній
already
вірш
happening.
прочитати, я думаю,
It's a
що та
slow one.
революція, яка має місце
It
у
shouldn't
сімейній
shed
медицині,
too much blood,
вона не
but it
повинна
should
бути
build
пов'язана з
on the
якимись
achievements of
різкими
others
заходами, вона не
to
повинна
go
пролити
forward.
багато крові,
Last
але вона
slide,
повинна
please.
постійно розвиватися і постійно прогресувати.
So bury me
Отже, поховайте,
Then rise you
розпалайте,
and
кайдани
break the heavy
порвіть,
chains,
і вражою
and water
злою
with the warrior's
кров'ю
blood the
волю
freedom you
окропіте.
have gained. And in
І
this
мене
great new
в сім'ї
family,
великій,
the family
сім'ї
of the free,
вольній, новій,
with softly
не
spoken
забудьте
kindly
пом'янути
word, remember
незлим,
also
тихим
me.
словом.
We remember them. Thank you.
І ми пам'ятаємо їх. Дякую.